Hello, Diaz here, founder owner Greenwood Dental. Today I am planning to talk about BOTOX. Many of my patients has been asking me about BOTOX, whether it's good or bad, whether they should get it or not. And I have been asked personally if I ever gotten BOTOX. And I've been honest through the years, I have. I have a history of migraine headaches through my whole family, the female side of my family, my mom, my sister, my mom's sister. And it's a horrible thing to have. So by age 37, my dermatologist have recommended Botox injection, which I had no idea that Botox is typically done for, to get rid of headaches per se. So I started doing Botox at 37 and it has been very, very effective for my migraines. And I got it when I was in my 30s every 6 months. But as I get older, I have to get it every 3 to 4 months because obviously the muscle age. So Botox is the botulinum toxin. It's a protein and it gets injected into the small muscles of the head and neck sometimes. Now there's indication of benefits for the neck muscles to relieve the tension headaches. And as I mentioned in my other videos for clenching and grinding causes a lot of tension and spazzing of the head and neck muscles. And some of you, unfortunately, wouldn't get a relief from wearing a night guard specifically or get a relief from medication. So that will indicate for us to directly inject the Botox into the muscle that's causing the tension for it to relax. Some providers or practitioners will describe it as it is a very short-term paralysis of that muscle, for it not to be engaging all the time when you guys clench and grind and create that constant status tension in the muscle, and as a result creating the headaches and creating the discomfort. So when you go and seek Botox from a provider, there are a couple of things you need to look for. I would get it with a medical profession or a dentist. A dentist is number one, because not because I'm a dentist, it's because we inject every day and we are so familiar with the head and neck. We deal with the head and neck every day through our career. I had injections by a dermatologist, I had injections by a dentist, and I had an injection by an MD. By far, the MD that I'm seeing now, she did miracles on my jaw. I do wear a night guard, but I clench a lot during the day when I'm working. And injecting the masseter muscle, which is a side muscle, and then the mentalis muscle, it helped my jaw relaxed. And I don't have that tension and pain, the spazzing pain that shoots up in my ear and my temporalis muscle. So that definitely gave me a lot of relief and a very, very successful. Of course, Botox, when it came out, it was created for, let's relax the muscle so you don't have the frowning lines and the wrinkles. That is true, but as of now, more research and more science is showing us that the application of Botox, even in the joints, giving a lot of patient a lot of relief. So there is a lot of stigma about Botox. However, just like everything else, if Botox is used with the right hands, in the right indication, with the right application, it's very, very successful from my own experience as a patient too. Yes, I am planning to be certified. I was supposed to be certified before COVID, and then they canceled the course. And I'm hoping this summer or spring, I'll be certified Botox and I'll be offering to my patient, since I had such a great experience with the with that medication, with that treatment to my jaw, head and neck. I have so many patients, they are desperately in need for that, because we tried everything else. We tried the night guard, we tried medication, and they are in a lot of pain. So what I would like to leave you with, 3 things. Number 1, to find the right provider. Please reach out to me, and I am very much know a lot of the Botox providers in the area, and find the right provider. Number 2, what they do is they have to examine the tension in the muscles, and they have to figure out how many muscles they need to inject and how many cc's they have to inject. So not everybody the same. Don't feel like, my friend got that much and I didn't. Everybody is different. They have to evaluate, like I said, the nature of the tension of the muscle and how much the muscle been engaged for how long, and then they can inject. For example, with me, my left side of my jaw got 20% more Botox than my right side, because my left side is a lot more tense because it engages. That's the way my jaw works. So I got the injection for 2 sessions, and then my jaw didn't need it. But last session I was in so much pain that she gave me even extra cc's, and it feels great. Everything is relaxed. Of course, there are side effects like headaches, dryness of the eyes, sometimes a little bit looping of the face, but it's not like you have a stroke per se. It's just because what happens, since your brain has been programmed to send signal for that muscle to engage, when you inject Botox in the muscle, the brain send a signal for muscle to engage, and the muscle is saying, I can't, I'm so relaxed. So it takes about 3 weeks to retrain your brain to stop sending that signal, because the muscle is not going to be engaging in such an intense level as it used to be. So if that happens, it takes about 3 weeks. That's for my personal opinion too. But it's very effective, and it has been proven to help a lot of people, which is very, very promising. The last thing that I would like you guys to keep in mind about Botox is, again, when you are young, you might need it every 6 months. But as you get older, obviously, like everything else, when the muscles age and they've been engaged for such a long time, you might need Botox. So you feel like you're going to need Botox a lot sooner, every 3 to 4 months. So keep that in mind. It doesn't mean they're trying to sell you more Botox. It just, they evaluate you every single time. And you will feel it yourself too, how the soreness comes back a lot earlier, every 3 months, not every 6 months. So I hope that helped. I hope that makes sense to you guys and help you decide whether you want it or not. If you want to wait for me, that's fine. But if you're in desperate need of definitely relief with the Botox injection, call the office and I will definitely refer you to the ones that I had a lot of success with and great results with. So thank you for watching. We love you. Be safe, and DS out.